Dr. Williams?
Thank you. HRSA, as an enthusiastic sponsoring partner of this report, would like to congratulate the study committee on such a thoughtful, robust, and compelling report. Educating health professionals to understand and to address the social determinants and to create interprofessional partnerships along with lifelong learners is consistent with the goals of the Health Resources and Services Administration, specifically our Bureau of Health Workforce. This is very much aligned with the work that we do and the work that we're trying to achieve, a lot of the goals that we're trying to achieve, and have been at this for a while. So we are very enthusiastic to receive this report. The Bureau of Health Workforce is committed to transformation of health and health care, improving the distribution of the workforce, making sure that the types of professionals that are available to the nation are where they're needed most, and also committed to preparing a well-qualified and diverse workforce. All of these elements you cannot achieve without having a good grounded understanding of the social determinants. And we also try to achieve these workforce goals through academic and community partnerships, exposure to longitudinal, interprofessional training experiences and practice experiences, and to also have those experiences rigorously evaluated. So again, the aim, however, is to prepare a well-qualified workforce to meet the needs of the nation. And that's the entire nation, and specifically those most vulnerable among us. And that tends to be in our rural and underserved areas. And in those areas, we see the social determinants, their effects are magnified in those with the least resources to counter any effects of the social determinants. So we, again, are committed to social determinants as a strategy to reduce and address health disparities, and only by reducing, addressing, and eventually eliminating health disparities can you achieve health equity. And health equity, we know we have achieved health equity when everyone has the full potential to be the best of whatever that they can be, that there are no barriers in any individual's ability to reach their maximum potential. That's how we know when we have achieved health equity. That's what we're striving for. So social determinants is the pathway to get there. So we appreciate this guiding document. And we see it as a way to support our ongoing efforts. That we also appreciate the focus on the three domains: the education, the community, and the organization. Within the education domain, the content, the focus on an education continuum resonates well with us, from the foundational to the lifelong learning. We also believe that that's important to have those experiences that are culturally based, that are longitudinal and interprofessional. We have long-standing investments in a workforce that has to be culturally sensitive, culturally appropriate, and culturally responsive. But beyond that, we also have moved in the direction in the last few years. We made multi-million-dollar investments in interprofessional collaborative practice, interprofessional education. We have, along with the Robert Wood Johnson Foundation, supported a National Center for Interprofessional Practice and Education. Our National Center is thinking deeply about the social determinants of health and preparing teams of health professionals and family members and community members to really work collaboratively together to address those invisible forces that are impacting what we see and trying to shape those outcomes in a positive way. We also appreciate the focus on community, having equal partnerships, reciprocal commitments, and real community engagement resonates well with us. And I think as I was reading the report, it it took me back to my community-based research, community-based participatory research days, and there was a lot of lessons learned that can be applied in this area as well. A lot of those things resonating that the researchers had to learn the hard way, that if you don't engage and that you don't have real trust and partnerships, that work tends to go nowhere. We also really appreciate the focus on the organization. And we feel that the organization often is the embodiment of the structural barriers and inequalities that the social determinants are often entrenched within these structures. And so that's where a lot of the work should happen and a lot of the focus. So shining the spotlight on the organizations themselves away from individual responsibility is consistent with what we feel is appropriate for this approach, and very pleased to see that approach on the organizations. Specifically within HRSA, we are a grant-making organization, and the majority of our funding goes to, within the Bureau of Health Workforce, to organizations. We've struggled and thought a lot about how to discriminate between those good grant writers that talk about commitment to social determinants and having some tangible evidence, so to speak, or some really concrete ways to discriminate amongst those organizations that can demonstrate a commitment to social determinants. We think that this document provides us a roadmap or a guide to, in that direction, when we can look for evidence of founding and guiding policies, when we can look towards organizational strategies and educational programs that are available, or leadership promoted activities. Those are concrete criteria that we can use that can even be scorable to really reward and incentivize applicants to demonstrate their commitment to social determinants. Transformative learning could be measured. Dissemination of case studies and evaluations could be counted. And so in our efforts to discriminate amongst those applications that we're seeing that really are working towards really having a meaningful impact and educating our health professionals, students, and faculty to be not only aware, but to be engaged in the whole process of social determinants. And my final comment would be that we have lots of investments that recent and ongoing that fit within this framework. We feel like we're in alignment with the work here and are excited about that. We recently, for 2016, released 2 funding opportunity announcements. One is entitled Educating BSN Bachelor of Science in Nursing Students in Community Settings. The idea behind that funding opportunity was to expose our Bachelor of Science of Nursing students to community settings where that they're comfortable, that they have the capacity to engage in the social determinants. These are structured as immersion experiences, extended experiences in the community, learning about more than treating patients in a patient setting, but being involved, being a part of a community. That is very consistent with what you describe here as community-based, interprofessional. These have to be interprofessional environments. The other funding opportunity announcement we released in 2016 was our interprofessional collaborative practice and behavioral health integration. So interprofessional practice teams, including behavioral health providers, in an integrated way so that comprehensive care can be delivered to individuals, their families, and their communities. This cannot be done without a firm foundation and understanding of social determinants. So we feel like this framework helps us as we move towards these continued investments, and we feel like we're on track. So thank you.
Thank you, Dr. Williams. And your comments reminded me, you're referring to HRSA already setting up some criteria that will fund programs that fall within the framework that we're proposing. And it reminded me of the NIH Precision Medicine Initiative that seeks to recruit 1 million people for gene environment type of research. And a extremely key component of that initiative is community engagement. So for NIH to be calling for community engagement at a really serious level, not a by the way, we're going to have communities, is quite telling.